Can depression in a person with intellectual disability look like anger or irritability instead of sadness? Absolutely. Depression does not always present as someone saying, "I feel sad," and when verbal communication is limited, the signs of depression can be very different and sometimes easy to miss. A person with intellectual disability may have difficulty identifying or describing emotions. They may not be able to tell you, "I feel hopeless. I have lost interest in things. I don't feel good about myself." Instead, emotional distress may show up through behavioural changes. The person may become more irritable, angry, withdrawn, restless, tearful, or unusually difficult to engage. In other words, the behaviour may be communicating the emotion. The most important clue is usually a change from the person's usual baseline. Look for loss of interest in activities they previously enjoyed, changes in sleep, changes in appetite or eating habits, reduced energy or increased tiredness, increased crying, irritability or aggression, social withdrawal, reduced participation in daily activities, changes in speech, facial expression, or usual communication. One symptom alone does not establish depression. The pattern and change over time are important. This is where diagnostic overshadowing can occur. If someone already has intellectual disability, new behavioural changes may be automatically attributed to the disability. For example, he's always been difficult. Or, this aggression is just part of his intellectual disability. But if there is a new and persistent change, we should ask, could there be an underlying medical or psychiatric problem? Pain, sleep problems, medication effects, anxiety, environmental stress, and other conditions can also cause behavioural changes. So a proper assessment is important. Caregivers often know the person's baseline better than anyone else. So pay attention to what has changed, when did it start, what activities have stopped, how is sleep, how is appetite, has there been a change in routine or medication? These observations can provide extremely valuable information to the clinician. So remember, depression and intellectual disability may not always look like sadness. Sometimes it may look like irritability, withdrawal, aggression, loss of interest, or a sudden change in behaviour. Don't simply label it as bad behaviour. Look for the emotion or problem behind the behaviour. If these changes persist or significantly affect functioning, seek a professional psychiatric assessment.